So when I was interning at ACE, I felt very much supported in my growth in different ways. I felt like the staff that I was working with at the time were very supportive of me. And Liz, my supervisor, she was very much like, do you have an idea? And she would let me like roll with whatever came to mind. I never felt like constricted, like, oh, you need to be doing this and this. So if I had something I wanted to do, I very much felt very supported. And so I really appreciated that I was allowed to like take out that creative side that I felt like I had never unpacked and explored. And so that I really have enjoyed. So working at ACE, I feel like I've been able to like make the impact that I want in different ways. I've been able to be provided the opportunity not only to do therapy, but also to be able to support individuals in like addressing other things that they need support with. And so I really enjoy that here we have partnerships with our parenting program, as well as we have case managers on site. And so they're able to like address things that I felt like in past jobs I haven't been able to fully support the individuals I work with. And so I really enjoy being able to take that team approach and be able to like really support the families that we work with. I feel like I've been able to see, most recently, I've been able to collaborate with my coworkers on different projects. One of those projects has been, I've been able to have pláticas or conversations at our local park. And so I've really enjoyed being able to like talk to parents about different struggles that they're facing with their children at home. And so I really enjoyed just being able to connect with our local community and be able to just have conversations that I feel like otherwise we wouldn't have anywhere else. So I have really enjoyed that. So I feel like I've been able to develop my skills as a therapist because I feel like I've been able to fully focus on the individual that I'm working with, because I feel like I don't feel that pressure of just of not being able to address the other ways that they need support, like if they need case management or support with like parenting. I feel like I'm able to like get support from my colleagues, and they're able to like also support the family. So I feel like less stress because of it, because I'm like, oh, I have, colleagues who are also helping, and we take that team-based approach. So I feel like better in the work that I'm doing because I'm able to fully focus on what I need to be working on with that person. So it really helps me. So I feel like in my time being at ACE, I've been able to have different mentors, both like my clinical director, but also just people who have like a wide range of experience, both like in their personal lives as well as their professional work. And so I feel like I'm able to like pick their brains when I have a situation. I'm like, I don't know how to like work with this or how to support this individual. So I feel like I've been able to like gain a lot of like just valuable like knowledge and just like an understanding of like the individual themselves, and that's really helped me in like just like knowing how to best support them, because I know every individual is different. So I feel like just being able to talk to my colleagues, and they're all very helpful and warm, and just like they're always open to like helping support you, and that just feels very reassuring for for me, and like just knowing I have someone to help support me through that process. So a piece of advice I'd give someone just starting off in their career in mental health is just going somewhere that will provide them with that support that they need. Because at the end of the day, like there are going to be situations that are going to be really hard, really stressful, and it just feels very reassuring when you have individuals around you who are going to be supportive of you in different ways, not just in the work that you're doing, but also just being there for you and like just being someone you can talk to or get support with or tag them when, when you might need a pause or a break in a situation. It feels nice to be able to have that support and just being in an environment that they very much value, like your self-care and taking care of yourself, because I know this job can be very like overwhelming at first when you're first starting, but it feels nice to be in an environment where there's that idea that, you have to first prioritize yourself, that idea of you need to take care of yourself before we take care of others. So I think that would be my biggest takeaway in the beginning when you're first starting, is just first taking care of yourself, because you're going to be taking care of others. So the nice thing about this role in being able to provide the service is that you're given the opportunity to provide therapy for any individual regardless of their insurance. And so I feel like you're able to make a difference to individuals who otherwise wouldn't be able to get this service. And also to address a lot of the stigma that we see within our communities around mental health. I feel like I've been able to have those conversations and change people's mind about what does it mean to get therapy, what does it mean to get that support that otherwise they might not receive elsewhere. So that's been like something very rewarding to me. So as someone who is just starting in their career, I feel like we provide a very supportive environment for anyone just starting in their career. I feel like we're able to also provide a lot of like opportunities to develop like our clinical skills. I've been able to be provided a lot of like trainings that I haven't had the opportunity prior to coming to ACE and getting. And so I feel like that's helped me in growing as a therapist. And so I think those are opportunities that are very rewarding and very helpful in my profession. Something that I would say stands out with ACE, among there's so many mental health agencies that one could choose to work in. I feel like what makes ACE stand out amongst all of those agencies is that I feel like we're able to very much have that conversation around finding that work-life balance, which I really appreciate, because, we work with individuals who have a lot of needs, but in doing so, we need to also be able to like find that balance of like taking care of people, but also taking care of ourselves. And so I feel like ACE does a great job of helping us like not to overwork ourselves, because then we also don't want to burn ourselves out, especially very early in our career. So I really appreciate that. So something I would want someone to know, and being given the opportunity to work in the Department of Behavioral Health at ACE, is that not only are you able to do therapy, which is great, but you're able to do so much more. I'm able to like also connect to like my local community, do like conversations with like at local events. I'm able to run groups. I'm able to plan events. Just most recently, I was able to plan an event where I was able to bring guest speakers for a group of young girls. And it's those things that really help me feel like to continue to have that drive that like motivates me to come to work and feel good about the work that I'm doing and just see that impact that we have on the individuals we work with. So I really have appreciated that, and hopefully that will have you consider applying.